Hello. Now we're going to focus on late adulthood, which to a large extent refers to people 65 and older. We're going to look at some variations within that age group and some theories of late adulthood. When defining late adulthood, you'll see a couple of approaches. For example, the census categories include the young old, or people 65 to 74, the old, or people 75 to 84, and the oldest old, people 85 to 100. And then, of course, the category that's growing considerably, in fact, people 100 plus. Developmentalists focus on quality of life. This is important so that if we see an age, we don't automatically assume too much about a given individual. Those who are enjoying optimal aging seem to have greater health, vibrancy, and social relationships. They're more than normal. Normal aging describes general tendencies for those of a particular age. Impaired aging refers to those who have more severe disability or social isolation than would be characteristic for their chronological age. We're going to look at age structures in society by exploring population pyramids. These are population pyramids of the U.S. that start in 1900 and end in the year 2040. When you explore these, one of the reasons I wanted to show you these was to, first of all, help you understand how much the population has grown, and then to explore the impact of having a large cohort. The area in pink indicates the baby boom generation. I'd like for you to think about how that large cohort may have influenced stereotypes about late adulthood that we've seen and are now trying to fight against. So we see in these slides, first of all, that in 1900, a much smaller population existed. And as you can tell, many people did not make it past the age of 50. In fact, we're looking at fewer people that would be in the old bracket at that time. Perhaps this led to stereotypes of the old that were quite reverent, views that they were wise or had some special knowledge that allowed them to go past a normal life expectancy, which at the time was 47. In 1940, we see that the population increases. In 1960, we see this large cohort, indicated in pink at the bottom of the chart, a large group born between 1946 and 1964, baby boomers. That group tended to bring about a lot of change in the structure. You can see in 1980, baby boomers were in young adulthood. By 2000, they're in adulthood. And in the year 2011, the first baby boomers began to turn 65. As we can see, the numbers of people in late adulthood in 2040 are considerably large. So I'd like for you to think about the focus and how it's been on baby boomers simply because they're such a large group for quite a long time. This younger generation tended to be fairly pejorative with respect to aging. We've seen a lot of stereotypes that are negative coming from this generation. Have you visited your local pharmacy or grocery store and looked at birthday cards for someone in late adulthood? Well, if not, I would encourage you to do so. I'm talking about in the United States because there is considerable difference across cultures with respect to stereotypes about late adulthood. They've been particularly negative in the West. Well, if you view some of these pictures or images, usually the cards are shown in cartoons. They depict older people as cranky, unfashionable, hard of hearing, full of disease, and that they have very little to offer. A lot of these reflect stereotypes that would be unacceptable if they were applied to some other variable, such as gender or race. Now I'd like for you to test your knowledge. True or false? There are about 10 million people, 65 and older, living in the United States. False. There are about 38.9 million people, and the number continues to grow. True or false? About half of those over 65 are in nursing homes. The answer? False. Of those 38.9 million, only 1.6 million are currently living in nursing homes. True or false? The number of people with Alzheimer's disease will increase by 2030. The answer? True. As more people enter late adulthood, the number of people with Alzheimer's disease will increase. True or false? About half of people over 70 experience hearing loss. The answer? False. About a third experience hearing loss. The number goes to almost half in people over 85. Now let's look at some theories of aging. Erickson suggested that toward the end of life, a person looks back over their previous experiences and hopefully they like what they see. If so, if they've lived according to their beliefs, they may feel a sense of integrity or understanding about their life. If not, they may feel a sense of despair because life hasn't been lived well and there's no time for correction. During the past several decades, social science has had a number of theoretical assumptions and perspectives on aging. In the 1970s and before, disengagement theory was popular. Disengagement theory suggests that as people get older, they begin to pull away from society, and society begins to pull away from them. They give up previous roles and to some extent become less engaged. This theory has been criticized for being ageist and for not recognizing the continued contribution and connection people have with society as they age. Disengagement theory was followed with activity theory. As people age and take on new roles, they take on new roles to replace those that they've lost through retirement, etc. Activity theory has probably guided some of the activities brought into the senior citizen centers and other institutions that focus on aging. However, that's been replaced by a new focus on aging known as continuity theory. Continuity theory suggests that as people age, there's continuity in the way they are and the way they have always been. They have the same desires, abilities, values, and livelihood as they had before. Continuity theory helps us understand ways to help people continue to be who they are as they age. There's considerable variation in aging. If you work with this population, it will be important to find ways to help them remain healthy, independent, and vibrant as possible. Most people in late adulthood report enjoying very good health, and most report being very satisfied with their lives. Again, it's a smaller proportion of this population who live in nursing homes, and if you work in allied health professions, you may not realize this, because you may spend a lot more time with people who have a lot of needs or are institutionalized or hospitalized. I encourage you to keep in mind that there are many opportunities for people in late adulthood. People 85 and older are increasing in number, so we will see an increase in those who need assistance along with those trends. Now let's look at average life expectancy in the United States. These vary globally, and this is addressed in your readings. In the U.S., however, in 1900, the average life expectancy was about 47. In 2007, we see a marked increase in life expectancy. For white females, 80.4 years. For black females, 76.8 years. For white males, 74.5 years. And for black males, 70 years. Why the differences? Differences, to some extent, can be traced to long-term or chronic sources of stress. For instance, historic racism. In evaluating aging, one way to categorize changes is to look at those that seem to be inevitable. These are referred to as primary aging, and those that are disease-related or secondary aging. It's important to make a distinction so that we don't see secondary aging as inevitable and therefore alter our ideas about medication or treatment or preventative care. Some examples of primary aging include skin becoming thinner and drier, and the same for hair. Height and weight tend to decrease. Body fat accumulates on the torso. Eye problems or severe eye problems are experienced by about 8% of people over 75. Less severe problems of vision are much more common. But here we're talking about things such as glaucoma and macular degeneration. Almost half, but not quite half, of people over 65 suffer hearing problems. I encourage you to keep in mind that the majority of people, even 80 plus, do not suffer hearing loss. Be cautious about using a particularly patronizing and discriminatory type of language called elder speak. Elder speak is a problem for those who work with older individuals. It needs to be considered and done away with. Some common diseases found in late adulthood include arthritis, hypertension, heart disease, stroke, diabetes, cancer, osteoporosis, and Alzheimer's disease. Why do we age? We're really not sure, but there are a variety of theories of aging. Some indicate that cell life has a limited duration. The Hayflick limit suggests that cells can reproduce about 50 times before they become senescent. This is due to a shortening of the telomeres each time the cell reproduces. Free radical theory suggests that as we metabolize oxygen, volatile unpaired electrons produce damage to cells. You may have heard of antioxidants as a partial solution to this damage. Protein cross-linking, which results in tissues becoming rigid and to lose functioning, DNA damage as a result of exposure to pollutants, and a decline in the immune system are also factors that contribute to aging. Exercise is an important way to maintain health, but we still find that a majority of people 65 and older engage in aerobic and strengthening activities very infrequently. Rates are higher for men than for women, and although we've seen some improvement in these numbers, there's still a long way to go. How does aging affect memory? One way to understand what we know so far is by looking at the sensory working and long-term memory. The sensory register is the first location for information that will make its way into our memory. It's affected by our senses. Certainly, we cannot remember what we cannot hear or see or sense in some way. So, to the extent that our senses are impaired, our memory of events will also be reduced. The working memory capacity starts to decline with age. Long-term memory, however, is more resilient to the impact of aging. How can you keep your brain healthy? Exercise is one of the best ways. Cognitive stimulation is also important. Abnormal cognitive loss of functioning is often disease-related. Dementia, which is a condition that can have numerous causes, Alzheimer's disease, a leading source of dementia, and many strokes are examples of diseases that cause cognitive decline. Poor nutrition, alcohol abuse, depression, and mixing medications are other causes. Delirium is a sudden state of confusion and agitation that some people experience when being hospitalized or institutionalized. Listen to the story in your lesson to learn more. Now we look at psychosocial development in late adulthood by exploring family life, friendships, and work. People continue to be very productive in late adulthood. A large proportion continue to work, and we're going to see that number continue to increase in the United States and perhaps throughout the world as retirement is no longer feasible for many adults. Another way that people continue to be productive is in education. The elder hostel is one opportunity and type of education that people can enjoy. Volunteering provides an avenue for our productivity, and for those who want to use their skills online, virtual volunteering is an option. This group is also very politically active. The majority of people in late adulthood, particularly males, are married. But there are also many who have lost their spouses. Widows are more numerous than widowers. The number of people who divorce in late adulthood is relatively small, but increasing. This number is likely to increase as baby boomers move through the lifespan. Those who've never married are not particularly regretful. Rather, they tend to be satisfied and used to their marital status. Cohabiting couples in this age group are not uncommon. There are some specific concerns for this group with respect to laws about inheritance, visitation, and other issues, especially for those who are in same-sex relationships. SAGE is an advocacy group that addresses these concerns. According to socio-emotional selectivity theory, people in late adulthood become more selective when choosing those with whom they want to socialize. And most people remain in the same neighborhoods they've always lived in as they age. Midlife and late adulthood are times when many people become grandparents. Some years ago, Sherlin and Furstenberg studied grandparents and created a typology of grandparenting styles. About 30% were considered remote. These are grandparents that live far away or only visit on special occasions. Of course, if they live close by and are still rarely seen, there may be some source of tension causing the distance. About 55% of their sample was characterized as companionate grandparents. These grandparents like to entertain their grandchildren and see them frequently, but discipline's left up to the parents. The remaining 15% were involved in the lives of their grandchildren on a daily basis and played an important role in decision-making about the child. Let's now turn our attention to frail elderly adults. The number of frail elderly will increase as the globe becomes grayer. The frail elderly need assistance in accomplishing daily tasks such as dressing and feeding and ambulating. Most frail elderly are cared for by friends or relatives. Typically, a spouse or daughter-in-law will provide care. Some frail elderly are cared for in nursing homes. Nursing homes have been criticized for focusing only on basic needs such as medication and hygiene. The quality of life is often very poor. The residents lack independence and are encouraged for being compliant and almost infant-like. Their psychological needs go unmet. Again, nursing homes focus primarily on basic needs. The quality of life is often poor. Residents lack independence and become infant-like as their needs go unmet. Finally, let's discuss elderly abuse. One of the most common types of abuse is financial, and it happens at the hands of family members. An adult child who lives with a parent and relies upon them may take advantage of their power to use the parent's financial resources or make credit purchases fraudulently. Neglect is common. It refers to a failure to provide adequate nutrition, care, and medical attention. Granny dumping is a type of neglect in which a person is discharged from an emergency room or clinic and then left abandoned to fend for themselves if family members are not contacted.